All right, good morning and good afternoon, everyone. Nice to have you online again. Some of you were here this morning, some of you it's the first time. This is part of the End Violence Pathfinding Learning Exchange series. Every month we have one session of things that people have, in fact, in our 37 pathfinding countries asked for additional information about. So in March, we had a session on the End Violence Knowledge Platform. In April, we had one on the methods menu for collecting prevalence data. Today, we've been speaking about costing a national action plan in the morning, and this session is being repeated in the evening because this was, in fact, one that had the most interest. In June, we'll be speaking about localizing national action plans. In July, about evaluation of national action plans. And then in August, we have a session on children's participation in national action plans. And so I want to start by warmly welcoming our speakers. So we have Philip from Maestral, and then Yoko and Catherine from the Kenya UNICEF country office, and they're going to be giving us a 20-minute presentation, 25 minutes on national action plans. In August 2020, the WHO launched the Global Status Report to End Violence Against Children. And in the report, we found that actually very few national action plans have all attributes of an effective plan. So very few of them have concrete goals, concrete timelines, details about sectoral implementation and responsibilities. And in fact, very little have costing information in their national action plans. We also know that very few of them are actually funded, which isn't surprising. If it hasn't been costed, it's a little bit hard to fund it. So we know today that governments, in order to get these costed, governments have to draw on budgets for implementation. These budgets are within their own ministries often, so we need to look around the broad range of economic costs and consequences, and then look within the different sectors where funds can be found to cost and fund the national action plans. So we're very excited. If you want to put any of your questions in the chat while the presentation is ongoing, please do. I've asked, rather than having a questions and answer after Philip's presentation, so between Philip and the Kenya country office, we've decided to do it all in one go, which is easier for recording purposes. And then we'll have 15 minutes at the end for questions, answers, and discussion. So over to you, Philip. Thank you very much.
Thank you. I'll go ahead and share the screen. So just bear with me for one moment. And get that set up for you. Thank you. That was the perfect introduction. You know, many years ago, I spent much of my career at the World Bank in the Human Development Department, which covers health, education, and social protection. And in those years, we had sophisticated costing models across all of those areas, you know, not just within the bank, but in the Global Fund, we have many other partners out there. Spent a lot of time trying to link the policies that they were advocating for in the human development centers to the actual resource needs to try to actually allow us to implement those ideas through public expenditure. When I started doing more work in the child protection sector, I immediately noticed that there was a real disconnect here. There was a propensity to create strategies and action plans and policies and statements of all different types, advocating for all sorts of elements of system strengthening, programs and services. But at the end of the day, many of these were lacking any kind of costing whatsoever. And not only costing, any discussion in the budget process in the government. So even when a government would say that they're interested in or would like to prioritize issues to address, say, violence against children, at the end of the day, we weren't seeing that translated into actual budgetary allocations. And it is interesting, you know, in these years, we see high levels of expenditure, not enough, but much higher than in child protection in the health sector and education. Health alone can be anywhere from 4 to 10% of gross domestic product, and education maybe half that, depending on the country. And that's all good. And then social protection expenditure, maybe 1-2% of GDP. But where's child protection in the mix? And where's VAC? So I'd like you to go into the chat box right now and indicate two things. One is, do you have an idea of how much your country spends on child protection and VAC? And if so, roughly what % of GDP would that amount be? And while you type that, I'll just continue on with a little bit more. The Convention on the Rights of the Child in Article 4 calls on states to devote sufficient expenditure to provide for the rights of children. But the convention doesn't actually define what the sufficient expenditure is. And so we don't have any real benchmarks, if you will, for what we should be targeting. And sometimes we do that in health and in education, try to set a percent of GDP as a marker of what might be adequate. I'm curious, Sabine, what are we seeing in the chat box with the percent that people are noting in their countries?
We don't have any, nobody's put anything in.
Okay, well, that means you probably don't know, which is perfectly normal because it's not tracked. But in our experience, it could be 0.1% or less of the national budget, and smaller than that for percent of GDP being spent on child protection in the countries that we've looked at through the budget. Instead, countries tend to rely on all of the foreign assistance coming from multilaterals, bilaterals, and private donors to fund their child protection programs. And a report came out this week that the amount of money US Christians are paying for orphanages around the globe totals about $3.3 billion a year, which dwarfs all of the aid budgets that I know of supporting other types of child protection work that's out there. So today we'll be talking about public expenditure and its piece in the puzzle, but let's keep in mind that private expenditure piece and the need to redirect it. I do want to say one indicator that we have comes out of Europe. 8 countries in Europe have been tracking child protection expenditure, and for them it's about 2.8% of GDP. That's the best that we have, but it is an indication that those countries are actively interested in and monitoring what they're doing in child protection. So there's another thing missing as well. There's some excellent analysis that many of you referred to on the costs of inaction. And there was a landmark report a few years back that violence against children is costing the global economy anywhere from, say, 2 to 8% of GDP, which is a pretty stunning amount. But that is a somewhat convincing argument, cost of inaction. What we haven't done is talked about economic returns from investing. So in the global north, you see actually a fair amount of this. If you go to Washington State in the US, they have this huge database looking at various types of child welfare programs that are out there, and they have a common model for assessing the economic impact. And in the vast majority of cases, they're showing huge returns, 15, 20%, 100%, 200% on investments. But in the global south, this kind of evidence is really lacking. And I just want to put out there for those on the call that it's something we need to think about, because it's much easier to come to a policymaker to show those economic returns from the investment than to just state a cost of inaction. At least we do have the cost of inaction. That's good. So let's talk a bit about the principles of effective public budgeting. These are more or less what the IMF or World Bank would be promoting in any of their public expenditure work. Most countries seek to achieve agreed fiscal targets on revenues and expenditures. They allocate their resources across different priorities. They seek cost efficiency and effectiveness. Many countries even require that each expenditure item be somehow linked to an outcome that is monitored. They usually plan more than 1 year, but so 3 to 5 years out. Importantly, they're crucially just concerned with the budget execution. So if they increase resources for an area, but those resources are not being spent, those resources are likely to be cut in future years. So it's very important when you advocate for more funding to ensure that you can execute it effectively. And then there has to be flexibility, because the budget is changing all year long. There's reallocation, shifts in direction, changes in government policy. So whatever is adopted at the beginning of the fiscal year isn't necessarily how it will play out during that fiscal year. The big question for you in all of this, you see the red arrow below, is where is your NPA in the priority needs? So if there's a big budget dialogue going on, do you really feel that you have good traction with your counterparts, champions within government that are influential, who may have come onto the violence agenda, but who may not be plugged into the budget. So, budget is the best indicator of public priorities. Governments will say anything you want them to hear, but the hard part is allocating the resources, because there are so many competing demands that are out there. So ultimately, the costing in a way is the easy part. It's where you fit in the policy dialogue that's a bit harder. And if you have your cell phone and you're new to this, I'd like you to either note this slide if you get a copy of the deck, or take a picture of it with your cell phone. But these are the 5 things as a non-expert it's good to know if you're managing a team on the ground. We're going to be hearing the wonderful example of Kenya in just a few moments. And these are the kinds of activities they've needed to think through and about as they've worked with and mobilized a costing team in Kenya. The first is, what is the framework for the budget decisions? What kinds of regulations have been published by the Treasury or Finance that govern the process, that set out the deadlines for the ministries and the agencies, that tell them what they need to provide? It's really critically important to know that. It's often publicly accessible on the web by the Treasury and Finance or through your counterparts in government. But that makes it reasonably clear how the formal process works. I think even more importantly, who's responsible for the budget? I just spoke about champions in government. You can know the deadlines, but if you don't have counterparts who are willing to really work with you to make the argument within your ministries and agencies, and ultimately before Finance and Treasury, then it's going to be hard to get any progress. And this is a much softer thing. There's no written manual on it. It really means getting to know people in the country, getting to know people in the ministries, asking and observing who has influence, and then trying to work as best you can with them. The basic steps are included in the framework. So making sure not to miss those deadlines on the basic steps. It's good to know what are the weaknesses in public expenditure and how can they be overcome, especially coming back to this issue of execution. I've seen countries where there's advocacy for more social workers to be included in the budget. But when you dig deeper, you see that there may have been some funding in the prior year for a couple dozen positions in social work that were never filled because the government was just unable to fill them. So those are the kinds of things you want to keep an eye out for. And then, as I said, you want to be prepared to be flexible if changes in the budget plan during the year occur, especially now in COVID-19. There have been so many changes in how governments are approaching budgets. And it's important to maybe even seize opportunities if more funding becomes available to the social sectors, but also be prepared if there are fiscal cuts or freezes in hiring. And this diagram just shows you a little bit about how the medium-term expenditure work. That's a common and fancy name across countries for a multi-year budget. So most governments do it this way. They plan for 3 to 5 years. I'm showing 3-year, sometimes a little bit longer, and they work to approve a budget in the first year, but they also agree on budget projections for following years, anywhere from 2 to 4 usually. And with those projections, you can, in your own costing, use those as an opportunity to set a baseline in year 1, but then in the following years to maybe scale up a bit in a way that's realistic and manageable, but that also shows that you're strengthening the system with more resources over time. And then year by year, the budget is approved again, and the projections are they then go out for another 2 to 4 years, and then another approved budget, another 2 to 4 years. This is actually a good thing. Way back a few decades ago, many governments went year by year, and it was terrible for planning. So now most are doing better on that. And there's an annual budget calendar that's really in any country with deadlines in it, and the process overseen by the Ministry of Finance. It's in that medium-term expenditure framework, which usually starts things off. It sets the parameters for the budget. My biggest message in this, you can read the steps on the right circle, is that there's no real starting point. The budget process is going on a continual basis, and you can enter into it at any time. In fact, the earlier that you are ready, if you've identified your NPA and you really know what you want to ask for, you can't get in too early because, again, you're coming in against competing priorities, and it takes a long time to get things moving. And sometimes you'll get traction in the social welfare ministry, but the Ministry of Justice is digging in its heels, or it's just not acting, or the Ministry of Health, and so on. So you can't go in early enough. Just try to develop those relationships and then keep them up. Yeah, you don't show up with a costing, have a workshop, and then leave and expect anything to happen. It's extremely important that you continue that engagement day by day, week by week, month by month. That's what all the other social sectors are doing. The health folks, the education, they're in there talking budget. We need to get child protection and back into those dialogues and really nest them in overall social welfare. The general approach is that the budget, for those of you who are supporting a costing, is to get the budget process launched and prepare a costing tool. You'll hear a lot more about that from Kenya. Collect the data for that tool. It's really ideal to get participatory budgeting and data validation, which can help your advocacy a lot in so many ways. And then a final budget submission according to the budget calendar, and continued advocacy after that. To see that at least some of it, hopefully all of it, is introduced in the budget plan. One really good thing for us is that we're spending so little that we don't have to worry too much about the fiscal implications of what we're asking for. You could double or triple, quadruple, 10 times what we're spending now, and it would be just the smallest amount in most of our countries compared to, say, asking for big increases in health expenditure, which is of course going on now with the COVID-19 pandemic. So if there's political will, they can't really object too much on the fiscal expenditure until they start getting up to 0.5% of GDP or 1% of GDP, and then you'll probably get much more in the way of pressure on the costing side of things, or how much the program costs. Thanks. What are you going to be asking for? You're probably going to be looking at resourcing the entire system, which means the capacity of the government and their partners to develop, manage, and administer policy, probably some sort of program to change norms, attitudes, and practices. But crucially, you're going to be looking at programs and services, and you'll be, again, hearing about that in the Kenya example. Often governments break the expenditures into two categories. The first being recurrent, that's a frequent term for it. That's salaries, payroll, utilities, transportation, training, and so forth. And then there are capital or investment costs, which are more along the lines of infrastructure, equipment, and vehicles. And in the Kenya case, they actually have two budget books, one for each of these, that are linked into one common budget. So it is important to think about if you are increasing the number of social workers as part of your problem, or psychosocial support, or family strengthening, and you're thinking about more personnel. Well, where are they going to sit? What are their offices going to be equipped with? What kinds of IT do they need? What sort of transportation? And all of this. And so that becomes part of the costing exercise. Usually we use Excel. It's a very flexible and extremely capable tool for budgeting. We strongly suggest that the way the model be designed parallel the government system. So whatever the regulations say the budget categories should be in the line items, the model should reflect that. It makes it much easier for the ministry to take the findings from the model and plug it into their budget request. So that's good. Usually you'll see in Kenya, there are some scenarios, baseline and beyond. Of course, these are multi-year, as I suggested, and they cover the different expenditure categories. And this is a picture of what you'll be seeing from the Kenya team, but just to note, there are macroeconomic assumptions and government expenditure assumptions that are derived. These are usually, some of these are easy to get from the Ministry of Finance because are even publicly available. Others on how you're going to deploy your expenses across your, from the national level to the subnational level, take a fair amount of work to figure out. And this is from Ebola recovery costing, Liberia in particular. It's quite successful. There's usually a summary of some sort in the costing that allows government officials to see, once you take all of the individual programs and services and the other capacity building, add it all up, and then you end up with a table summarizing the overall costs. And the percent of those costs is percent of GDP is a percent of government expenditure. So to close, I want to re-emphasize some of the themes that I've mentioned already. The first is it's hard forced to say that you have a national priority unless you see it reflected in the budget. So please, I think there's a culture change here of trying to get our child protection teams and our VAC teams to really make costing and public expenditure part of their weekly and monthly and annual work as the budget process continues in that cycle I showed you. Start early and don't stop supporting it. I didn't go into this too much, but the model might look a little bit scary. It's actually the hardest part of this is defining what you want in the model, what specific services you want, where they're going to be, and then what they look like, because the costing experts can't cost something that is not clear to them. So this is where, in a way, you get real implementation. It's quite exciting when you go from these big high-level ideas about supporting strengthening of families and the like, down to real programs, real services, real resources. So it's a good process that way. Stick with the regulations and approaches, note the deadlines, don't miss them. Understand how the expenditure is going today. If already your counterparts are having trouble spending budget, it's going to be so much harder for them to advocate for more. So just try to get a handle on that even early in the process. And maybe there's some ways you can help with capacity building on hiring and the like to help things along there. I just mentioned focus on the content, let the costing experts do the modeling from that side, and it's a great partnership. And then so important, we don't want to be doing this for the government year after year. We want to advocate before government, but we don't want to do the costing. So to what extent can we build up the capacity of our capacities of our ministries to do the costing and public expenditure work, and then come in with how we can bring private resources to the table, how we can bring ideas, how we can advocate for more, but leave it to them to do the costing themselves. I'll leave it there and we'll move on to the Kenya case. Thank you for your attention.
Thank you very much, Philip. As Catherine is setting up her slides, if anybody has any questions at this point, please pop them in the chat. I think it's very interesting how when we think of costing, we just think it's a bunch of numbers, but actually we're seeing that there's so much linked to timing and advocacy and political prioritization, which we're clearly still struggling with as a field. And then there's the big numbers component, and Catherine is going to present to us how they've actually managed to crack that nut in Kenya. And for those of you like me who are wondering, we're speaking to Philip before the call, and we asked him how many countries have actually done this, and there's actually very few. So Tanzania did it, Uganda did it, now Colombia's in the process, Ethiopia, but I wouldn't say we have 50 countries that know how to do this very well. So all the more reason to listen carefully to these presentations. Catherine, I hope you can share your screen. Yeah, perfect. Over to you.
Okay, thank you. I'm trying to have this up. Greetings to everyone. I'm Catherine. I am a child protection specialist in Kenya Country Office, and privileged to have worked with the Maestro team in the costing, and happy to hear Kenya is among the few countries that are doing this. We'll present two of us with Yoko. I'll do the first part, which will be about the general child protection costing model. And then Yoko will look at the costing of the National Plan of Action for VAC. For Kenya, we took costing as an entry point of improving budget allocation for child protection systems and services. And this was within what we were, within the overall approach of strengthening child protection in Kenya. And we had a number of components that we were looking at, and this was one of them. We started in 2017. I hope you are able to see that. And with quite a number of partners, and it was because child protection has many stakeholders, but we finally narrowed down to Department of Children's Services. And the debate we started with was, how do we cost the system? Because at that time, Kenya was talking about system strengthening, and we were moving away from thematic areas, and had to understand what constituted the child protection system that then would be included in the budget. To support this work, my ESTRO team, together with UNICEF and Department of Children's Services, visited 3 counties to understand the services and how these services are provided by the various partners, especially Department of Children's Services. And we had to engage personnel from finance and planning within the ministry and also within the National Treasury. And after the work we did, we conducted a master trainer, but we stalled the process for 1.5 years and restarted. And I will mention why this was stalled. The main features of the child protection costing model, it's Excel-based, just like Philip said, and it's informed by existing budgets of 3 previous years. So we had to get that information to work as the baseline, and it's categorized into development and recurrent costs. I'll show that. And with the debate we had with the children's services personnel, we had to ask them what do they need to be able to provide the services they have to provide, including prevention, like outreach and going out to the children, and also response, like rescuing children or giving them psychosocial support. And when we looked at all that budget, it was very high. So we had to get it down to what are the non-negotiable, the basics. And then we also looked at what, if there was more money, what a little more would be added. And also we looked at the ideal, and budgets were generated based on the 3 scenarios. And these have been given at what is the percentage increased based on the existing budget. Also, the module looks at services at different levels: national, county, sub-county, and institutions run by Department of Children's Services, like rescue, rehabilitation home, remand homes, and such. And then it does provide formulas for consideration of the population of the various parts of the country, and also geographical location because of issues like communication, transport, and any other unique child protection concern. Those are all factored in. Just to say, for the lessons learned, for us, it was like bringing 2 different worlds together because we had now the child protection workforce, the social scientists, and we had the finance and the planners. And it really took us time to conceptualize each other's work. How do the planners and finance do their budgets? And for them just to understand what is child protection, including those who are in UNICEF. That was a big one. And then it is very important to know, as we approach the planners and finance people, to be able to communicate to them. A big challenge we had was accessing finance documents or budget documents. And in some cases that took us like 6 to 8 months. And even now there's some piece of work we are doing. There are some finance people who cannot let documents out for this work. We also noted that to convince the finance people, and just like Philip said, we have to back our discussion with evidence that makes a rationale for what the other people see like a big budget. Because one of the things they said, we have given budget to social protection, that is the cash transfers. We've given money for education, for health. What is that more you're asking for? And we have rescue centers. So just convincing and saying child protection is not about all rights, it's about issues around abuse and exploitation and violence. So we really had to prepare for that. And then just to say, once the costing, I hope you are seeing that, I'm blocked. Once the costing model is understood, there is acceptance and a request to even support more. And we have been approached already to support the ministry to cost the children's bill that is in Parliament for debate. I will now go to just a snapshot on a costing model for a few minutes. Are you able to see this? Hope
Yeah,
so.
can you just scroll it up a little bit?
Yes.
Yeah, maybe make it, yeah.
Is that better?
Yeah, and maybe just, increase the size a little bit. Perfect, that's perfect. Oh, now you're too big, we can,
Yeah. I'll just show you the summary page. As we said, it's Excel-based and it's a heavy document. I think we have, let me show you, quite a number of worksheets there, and they all link up and they are quite detailed. Our summary worksheet is here, and we are talking about the recurrent cost and the development cost, and this is the very, very summarized final part of it. What we had by then, that was, this is the baseline I have for this, but we have an updated one. And then we have the basic scenario for year 1, 2, and 3, and enhanced scenario and ideal scenario. But below here, we look at the current investment and additional required funding and the percentage increase, which is 197 at basic scenario. So we've done this for all the scenarios. For enhanced, it's 239%, and at ideal is this. And this is in USD. The rest of it is in Kenya shillings. And this is what we have been using to advocate for additional funding, but we are not yet there. I will just show you the costing we have used for the county and sub-county children offices, looking at the staff that are required and divide and multiplying this with a number of figures out up here. And this looks at, again, basic, enhanced, and ideal scenarios. Also the sub-county children offices, what kind of, the number of staff they require. Then we had a big debate on the goods and services, fuel, vehicles, awareness for prevention, training, and child protection volunteers, airtime. Then we have utilities, and we have capital investment. So just to give you a snapshot of that. I will go back to the slides and call upon Yoko to help us continue with that other part of the presentation.
Thank you very much, Catherine. Now I'm going to speak about National Prevention and Response Plan on Violence Against Children in Kenya, 2019 to 2023, that was launched in last July in the midst of COVID-19, along with the 2019 Violence Against Children Survey Report and its child-friendly booklets. And one thing I would like to highlight here is that for Kenya, or the government of Kenya, both the Violence Against Children Survey and the national plan itself was the second round kind of efforts, as the government of Kenya has already published the 2010 back survey reports, as well as the 5-year response plan from 2013 to 2018. So both the development and implementation of the National Prevention Response Plan on BAC 2019 to 2023 is based on the lessons learned from the implementation of the previous 5-year National Response Plan on BAC. And I highlight 3 aspects of important key lessons learned, which is related to today's topic. The first one is the importance of having monitoring and evaluation framework in place within the national plan so that we can track the progress made in terms of implementation of the national plan. Secondly, as we all know, violence against children is the multi-sectoral effort. However, we need to have a clear accountability in terms of which department agencies is to take lead of the strategic actions within the National Prevention and Response Plan. And thirdly, and most importantly, costing of the plan, because without the costing, evidence-based resource mobilization efforts was not possible. Next slide, please. And another highlight of the current 2019 to 2023 5-year National Prevention Response Plan on BAC of Kenya is, as you can see, we have 6 strategic areas ranging from laws, policy, family support, parenting, economic strengthening, education, life skills, norms and values, response and support service and coordination, very much mirroring globally available evidence-based strategy to address violence against children, namely INSPIRE package. And under this plan, we have 86 actions that was developed by participatory, in a very participatory manner by the multi-sectoral technical working group that constitutes child protection actors, social protection, social development, education, health, stakeholders, both from the governments, but also civil society organizations. Next slide, please. So what I'm very, very happy about the National Prevention Response Plan on BAC in Kenya is that in Annex 4, we have a very clear indication of sector contributions. We have 4 sectors included here. The first one is social protection, social development, child protection related, and gender included. And the second one is judicial, third sector is education, and the fourth sector is health. And under this sector contribution, we have identified in the table matrix which ministries or departments or agencies are actually leading that strategic actions. And supporting actors also include not only the government, but also development actors, civil society organization, and the private sectors. And this is quite important when we talk about costing, because in the costing tools, it is assumed that the lead actors are indeed the budget holders, while the resource can come from various sectors and areas. Next slide, please. And we are very much lucky to have been able to engage both Maestro International and Cornerstone as our technical expert agency to walk this journey together with the government of Kenya. An objective of the costing of the National Prevention Response Plan on BAC was obviously to provide guidance on the required budget to implement the plan. And our experts has also really emphasized that this process has to be a participatory process, engaging all the multi-sectoral government agencies and CSOs involved, so that the costing model itself is going to be finalized with their inputs contextualized in Kenyan specific situations. And most importantly, they will have a sense of ownership of the costing model that is going to be finalized at the end of the day. And the first step that we took was to really scrutinize all the actions within the National Prevention Response Plan. There are 86 of them under the 6 strategic area that I just mentioned. And out of 86 activities or actions, we needed to define the scope of the costing exercise by identifying by identifying which actions are going to be included and which are going to be excluded. So in total, 18 actions were indeed excluded from the costing exercise, mostly because they duplicate with each other and we wanted to avoid double counting, so that it will inflate all the resources needed for the implementation of the National Prevention Response Plan. And other actions that were excluded include the core mandates of some of the departments of agencies that are going to be already allocated enough budget to do that. And others were, some activities actually were not needed to be costed. So some of these activities have been excluded. And second step that we took was really classifying all actions into 4 areas of activities. As you can see in the table in front of you on the right side, there are 4 categories of activities classified based on its nature. The first one is developing policies, laws, and plans. The other one is the training and awareness raising and campaign. And the 4th category is others that include response services as well as infrastructure investment. Next slide, please. And based on this nature of activities, we have identified the most suitable costing approach, which is the unit cost-based costing. And the costing tool specifies the unit cost of 3 sets of standard activities that as I mentioned. And the second step, the next step that was critical was to make assumptions. All the good costing tools actually makes a very transparent and clear assumptions shown in the tool, so that whenever the future users come in, they can easily change and update them. And these assumptions included the price list based from the September 2020 price, as well as exchange rate and the general assumptions that include the total number of population, household, the number of schools, and so on. And thereafter, information was gathered related to the activities involved in implementing the different activities, the inputs required to perform the different activities, the price of the inputs, and the demands for the different activities or the quantity of different activities required. And thereafter, an MS Excel-based costing model was developed for the government agencies' use. And the compression of the costing model was again done in a very close consultation with respective government stakeholders. And once the costing model was completed or finalized, costing results was compiled. And last December, we were able to carry out the validation workshop, again, including the multi-sectoral stakeholders. And lastly, the budget explanation booklet was produced for the future use and also explain for those colleagues who are not able to participate in this process, still to understand the process that took place, as well as the costing model and the costing results. Next slide, please.
Yoko, can I ask you to wrap up, because we might have just a couple of questions.
Sure. So this is how it looks like. It has basic, enhanced, and ideal scenario. As Kathleen mentioned, this having 3 scenario was quite important, so that we look at the current fiscal space and the budgeting situations and utilize in our advocacies the most appropriate scenarios. And perhaps in the context of COVID-19, the basic one is the most appropriate. And overall total is also divided into one-off activities as well as ongoing activities. One-off activities are those one that can be done once or paid once and no longer needed. And ongoing activities include something, training, the workshop, and also awareness raising activities that might be required to be carried out throughout 5 years of the National Prevention Response Plan on violence against children. Next slide, please. So this is the a kind of snapshot of the 5-year 5-year costing results. Again, divided into 3 scenarios and one of activities, ongoing activities, just to have a snapshot of how much it requires to carry out the National Prevention Response Plan on back under different scenarios. And the next slide, please. And just to touch base on the lessons learned, obviously this costing was done based on the lessons learned from the previous response plan, which was not costed. And I just want to highlight that this costing of the National Prevention Response Plan on back was based on or building upon the child protection systems costing that my colleague Catherine has mentioned. Because this National Prevention Response Plan on back costing does not include utilities, the workforce need, infrastructure need that is already covered, the CP systems costing. So it's very much complementary and there's no duplication with the CP system costing. And it's really, the whole process benefited from an increasing level of awareness, understanding, especially on the part of our main counterparts, the Department of Children's Services, who have been also walking the journey of CP system costing. But having said that, I really want to emphasize much more work still needs to be done to ensure the costing model is fully utilized for annual budget process, as well as continuous advocacy for necessary resource mobilization. I'll stop here and I would like to hand over to my colleague, Catherine.
I'm afraid we're gonna have to wrap this one up and people are just gonna have to read this one because I think Philip wanted to add one more thing and we really only have a couple of minutes. But I just have a quick question because I think it's just Herculean what you guys have managed in Kenya. So huge bravo, first of all, but I'm curious to know what you found was the biggest challenge in the work in Kenya. And then I want to hand over to Philip to wrap up and to add what he wanted to say.
I think I'll start with the general child protection costing and Yoko for the NPA. I think for me, it's just making the Department of Children personnel understand and also the ministry, because this was quite new to them and they hadn't done this detailed budgeting. And I think that was a big challenge. And also the one I mentioned about acceptance by the planners and the finance people, even to an extent of supporting the process by giving the required documents. Yeah, I think that's one of the big challenges. And as we said, we are not yet there. We are continuing with the work up to now and with the advocacy and capacity building. Yoko on NPA.
Yes, just very quickly, I think we started off very well when we had a physical workshop, deep dive into costing, which kind of included capacity development elements of it. But then thereafter COVID-19 hit and all the engagements became virtual. And when it comes to costing, I think it's really important to have this workshop, the capacity development aspect, so that's the government's counterparts, the stakeholders.
This is exactly what happened this morning. So I think Yoko is frozen, but it's perfect timing. Philip, I'll let you wrap up.
Thank you. And I think Kenya is just a great example of some excellent work and management by UNICEF of the process, and that a lot of the world can learn from it. I just wanted to highlight with COVID-19, there are a lot of fiscal pressures on governments, but there are also opportunities for the VAC agenda. Kenya, which we've just been speaking about, has received about $1.8 billion in COVID-19 mitigation loans. And a piece of that is going to fund cash social protection. Now you take that $1.8 billion and you look at what this team has costed, which is just in the millions of dollars at the moment. So, and I need to add that the World Bank is concerned about violence now. It's a thematic area for them. It wasn't when I worked there, but it is now. So really to try to find opportunities in your country to work with bank colleagues who are really involved in that budget dialogue, to bring these issues to the table, to note the big increases in violence that we're witnessing with COVID-19, and to suggest that we need to move beyond just a cash social protection response, which is important, but there are other things we need to do to strengthen families and to reduce violence in order to really improve the welfare of these societies that we're working with. So I'll end it there, and thank you for the opportunity for participating in this.
Thank you very much, Philip and Catherine and Yoko. We really appreciate it. It's been so interesting. And let's hope that in a year's time, we'll have many more examples that we can keep sharing. And in the meanwhile, we have your PowerPoints and the recording, and we will share it with people that weren't able to participate. Thank you all very much, and I wish you a lovely weekend.
Thank you.
Bye-bye.